there any key elements in relation to the health region reform that you think would benefit people hearing about here today?
I think listening to this morning and thinking about the change in structures, I think there are some things. The new structures hopefully will give the possibility of joining things up more easily. It's part of a much wider journey around what Sláinte Care is to deliver, and structures, of course, of themselves don't deliver anything. It's people working in care processes and with patients and service users that do that. But I think in listening to some of your presentations this morning and the words that were coming up around barriers and possibilities and the need to reach across boundaries, I think for the likes of Tony and his 5 colleagues who will be coming into their roles on the 4th of March, I think it is, Tony, at this stage, there will be, I think, an opportunity to build on the kind of work you're doing across care environments in the interests of patients and service users, and the structures can help with that. It'll certainly, hopefully, help remove barriers. And you've emphasised technology quite a bit. That's also a focus within the overall Sláinte Care change approach, but you're doing that very locally, which is very relevant. From our point of view, we're still working on the detailed reshaping of the centre, so there isn't an operational component at the centre. That, of course, is about trying to move decisions more locally and away from a central point. I've sat in an office in Dublin receiving loads of forms to be signed and returned, both in Dublin and elsewhere, and it's not really necessary, and part of this change will hopefully remove some of that. And Bernard has set out what he thinks a revised centre would look like, and our job is to implement alongside his guidance. At a regional level, Tony and colleagues will work on what a regional structure underneath a regional executive officer will include. We already have almost final stage drafts of the top level of that, and there's further engagement around the further levels, but it is also looking at how do you join up clinical governance, having regard to the fact that service is much more widely delivered, and that we need that kind of joined up practice that you're reflecting here. So we're aware of those things. Of course, our narrow job is to support a new structure coming into place and to support Tony and his colleagues and Bernard in getting that up and running. The real magic happens after that. I think it's really in the implementation and working with and through processes like these, which are locally driven, locally enabled, but still need to be supported from a central space, but a more local central space.